Turmeric has been used for centuries as a powerful natural remedy, widely praised for its anti-inflammatory, antioxidant, and immune-supporting properties. Many people believe that because turmeric is natural, it can be consumed freely with any food at any time. As a medical professional, it is important to clarify that this assumption is incorrect. Even the most beneficial natural substances can cause harm when combined improperly. Turmeric contains an active compound called curcumin, which strongly influences digestion, blood chemistry, liver enzymes, and inflammatory pathways. When turmeric is consumed with certain foods, especially on a regular basis, it can trigger reactions that are harmful, particularly for seniors. The first critical concern involves consuming turmeric together with foods that are extremely high in oxalates. Oxalates are natural compounds found in foods such as spinach, beetroot, Swiss chard, and certain nuts. When turmeric is combined with these foods, oxalate absorption in the body can increase significantly. This combination raises the risk of kidney stone formation, especially in older adults whose kidney filtration efficiency may already be reduced. Turmeric itself contains a moderate amount of oxalates, and when paired with high oxalate foods, the cumulative effect becomes problematic. From a medical standpoint, this interaction is especially dangerous for individuals with a history of kidney stones, chronic kidney disease, or dehydration. Seniors are more vulnerable because age-related changes reduce the kidneys' ability to flush excess minerals effectively. Consuming turmeric with high oxalate foods may silently accelerate crystal formation in the urinary tract, often without immediate symptoms. By the time discomfort appears, the damage may already be significant. Another overlooked issue is digestion. Turmeric stimulates bile production, which helps digest fats. When turmeric is consumed alongside heavy, oxalate-rich vegetables or raw leafy greens, it can irritate the digestive lining. This may cause bloating, abdominal cramps, or altered bowel movements. In seniors, whose digestive systems are more sensitive, this irritation can lead to chronic discomfort. The safest medical advice is not to eliminate turmeric or oxalate-rich foods entirely, but to separate their consumption. Turmeric should be taken with balanced meals that include moderate, healthy fats and low oxalate vegetables. Hydration is also critical. Adequate water intake helps reduce the risk of mineral buildup in the kidneys. Timing matters, and spacing turmeric intake away from high oxalate meals significantly reduces risk. In clinical practice, many patients are unaware that their kidney or digestive issues are linked to dietary combinations rather than a single food. Turmeric is powerful, but power must be respected. Understanding how turmeric interacts with other foods is essential for safe, long-term health, especially in older age. The second major food group that should not be consumed with turmeric includes foods and beverages that significantly affect blood clotting and blood pressure. Turmeric naturally acts as a mild blood thinner by reducing platelet aggregation. While this effect can be beneficial in controlled situations, combining turmeric with certain foods amplifies this action and increases the risk of internal bleeding, dizziness, or sudden drops in blood pressure. Foods rich in salicylates and natural anticoagulants, such as garlic, ginger, ginkgo-containing products, and certain herbal teas, can dangerously intensify turmeric's blood-thinning effects. When consumed together regularly, these combinations may interfere with the body's natural clotting mechanism. For seniors, this risk is even greater because aging blood vessels are more fragile and healing responses are slower. Another concern is consuming turmeric alongside alcohol or fermented foods. Alcohol already stresses the liver and alters blood circulation. Turmeric, when combined with alcohol, can overburden liver enzymes responsible for detoxification. This combination increases the risk of liver inflammation, stomach lining irritation, and abnormal bleeding tendencies. Seniors who consume even small amounts of alcohol while regularly taking turmeric supplements or turmeric-heavy meals may unknowingly increase their risk of gastrointestinal bleeding. Medical evidence shows that turmeric enhances the effect of blood pressure-lowering mechanisms when combined with foods or drinks that naturally lower blood pressure. such as excessive citrus juices or certain herbal infusions. It may cause sudden lightheadedness, weakness, or fainting. These symptoms are particularly dangerous for older adults due to their increased risk of falls and fractures. From a physician's perspective, the most important rule is moderation and awareness. Turmeric should not be combined excessively with other natural blood thinners in the same meal. Seniors taking blood pressure medication or anticoagulant therapy must be especially cautious, as turmeric food interactions can intensify medication effects without warning signs. The safest approach is to consume turmeric with neutral, easily digestible foods such as cooked vegetables, rice, lentils, or healthy fats like olive oil. Avoid pairing turmeric with alcohol, excessive garlic, or herbal blends that influence circulation. If turmeric is being taken for inflammation or joint support, it should be consumed at a consistent time of day, away from other potent bioactive foods. Medical advice always emphasizes that natural does not mean harmless. Turmeric has pharmacological activity similar to some medications. Respecting its interactions is critical for maintaining balance, particularly in aging bodies. The third and most overlooked category involves consuming turmeric with foods that disrupt iron absorption and gut lining stability. Turmeric has the ability to bind iron in the digestive tract, reducing iron absorption significantly. When turmeric is consumed with iron-rich foods such as red meat, liver, fortified cereals, or legumes, it can interfere with the body's ability to absorb this essential mineral. Iron deficiency is already a common concern among seniors due to reduced absorption, efficiency, and dietary limitations. When turmeric is habitually consumed alongside iron-rich meals, it can worsen fatigue, weakness, shortness of breath, and cognitive decline over time. This effect is gradual and often goes unnoticed until blood tests reveal low iron or anemia. Additionally, turmeric should not be consumed with dairy-heavy or highly processed foods. Dairy proteins can limit curcumin absorption, while processed foods increase gut inflammation. When turmeric is combined with these foods, it may irritate the intestinal lining rather than heal it. This irritation can lead to acid reflux, nausea, or a burning sensation in the stomach, particularly in older adults with sensitive digestion. Another important medical concern is consuming turmeric with very cold foods or drinks. Cold temperatures slow digestive enzyme activity. Turmeric requires proper digestion to be metabolized safely. When taken with cold beverages or chilled meals, turmeric may stagnate in the digestive tract, increasing the risk of gas, discomfort, and improper absorption. From a professional health standpoint, the ideal way to consume turmeric is with warm, balanced meals that include healthy fats and gentle spices. Turmeric should be taken separately from iron-rich meals by at least 2 to 3 hours. This spacing allows both turmeric and iron to be absorbed effectively without interference. Seniors should focus on consistency rather than quantity. Small, regular amounts of turmeric consumed correctly are far safer and more beneficial than large doses taken improperly. Monitoring how the body responds is essential. Any persistent digestive discomfort, weakness, or unusual symptoms should prompt dietary adjustment. In conclusion, turmeric is a valuable natural compound, but it demands respect. Avoid combining it with high oxalate foods, blood-thinning foods and alcohol, and iron-rich or digestion-disrupting foods. Used wisely, turmeric can support health. Used carelessly, it can silently contribute to serious health problems. Responsible consumption is the key to long-term wellness.